A lot of people struggle with knee pain, knee tightness, rehabbing a knee injury, or just feel like they cannot move their knees well and freely. And the frustrating part is that even after doing a rehab, exercises, or physio, the problems keep coming back. So what's going on? The most important part to understand is this: the knee is not a hinge joint, but that's exactly how it's most often treated in rehab and in training. Most programs assume the knee just bends and straightens like a door hinge, but that's incomplete. Biomechanics research shows something very different. During knee flexion, this shin bone called the tibia will internally rotate relative to this distal femur, which relative to the tibia externally rotates as we're bending the knee. So a knee bend, this shin bone will internally rotate. For example, the conclusion from the study from Guan Li and colleagues, they said axial tibial rotation is a characteristic motion of the knee. They also measured 6.8 degrees plus minus 4.5 degrees of internal tibial rotation during early knee flexion. Other research also confirms that flexion and extension facilitate internal and external rotation at the knee. And here's the problem: most rehab programs completely ignore it. They focus on just extending and bending the knee without foot contacts, so they are not focused on the rotations that need to happen in order for the knee to move like the knee should. But if your knee can't rotate properly, then movement becomes restricted, the forces get absorbed and distributed poorly, which can lead to pain over time. So a human body works like a closed pressurized system, which means your body has to position the segments of your leg properly when your foot hits the ground. That way the force can travel efficiently up the chain without putting too much stress on the structures that weren't made to take that stress. And this is where everything starts to connect. So what should happen when you walk? When you step forward with your foot, you create a heel strike, and once you land the whole foot down, your center of gravity starts shifting over that foot. That heel will internally rotate, and that internal rotation will propagate up towards the knee, so all of the segments will internally rotate, so the forces and internal rotation can happen at the knee, at the pelvis, so the body can store and release energy as efficient and safe as possible. And if this doesn't happen because of things like overactivity on the bottom of the foot, overactivity in your external rotators, which pushes your center of gravity forward and flowers the pelvis open, everything will start turning outward. So the body will start finding the compensations for that lack of internal rotation. So that's where we can start seeing duck feet, knock or valgus knees, or even that hyperextended knees. These are not random problems. These are the solutions. Your body is actually saying, I cannot internally rotate, so I will point everything out and use a compensatory strategy to push downward into the ground to hold you up. Now, this is where most people go wrong. Most rehab focuses on strengthening muscles, isolated exercise, and open chain exercises. But here's the reality: you don't control your body in isolation, you control it against the ground, because that's how a closed chain systems work. And muscles behave completely different once we start looking at them this way. Take the tibialis anterior muscle, for example. If we're laying down and we pull our foot up using the front of our shin muscles, which is the tibialis anterior, our foot, our midfoot will externally rotate, our ankle will dorsiflex, and that's basically what that muscle does when trained in this open chain environment. But when you're standing, everything changes. Now you have a foot on the ground and your body's center of gravity that is shifting on top of that foot. So taking the two attachments of that muscle, first being underneath the foot arch and the second being on the upper outside tibia or your shin bone. Now, when this muscle contracts, as you're shifting your body over your foot, it will help to control your arch, but at the same time, the contraction of this muscle will help to internally rotate your tibia at the knee, which is what we want and it's necessary for that tibial internal rotation. So the same muscle works very differently based on the context, which is why band work, leg extensions, or random strengthening don't fix the underlying issue, because they don't train how your body actually functions when it interacts with the ground. Because of all this, and because I've worked with so many clients that tried everything, did rehab for months and never seen results, I built a 24-week 6-phase structured knee program that rebuilds your knee step by step. I basically included all of the exercises I learned from other coaches and mentors and that I use daily with my clientele and just throw them all into one program because I know they work. This program focuses on getting your knee to move well again, restoring that internal rotation at the knee, rebuilding control under load, training in closed chain environments or with that foot on the ground, which happens as you play sports or walk around, strengthening exercises that actually support that rotations in your knee, learning how to absorb forces at higher speeds, but also a bonus phase at the end to train quickness and explosiveness. This is exactly what I use with my athletes, clients in pain, or just people who want to move a little bit better. Right now, there's an exclusive offer for the first 100 customers, and you basically get a full program for the price of a single consultation. If you're interested, follow the link in the description. Before you even consider that, try this 3-step progression that is going to take you through the activities that we do in the program, where we regain some range of motion in the knee first, then mobilize the knee for that internal rotation, and then control that position under some load. I'm going to start on my hip bone, right on the side, on the hip bone, and from here I'm going to step this top leg over and I'm going to roll the outside of my thigh down so the foam roller moves towards the knee, about halfway there, stop here and bend the knee. Return back. So roll from the hip to the knee, about half of a way down as you bend the knee, just like that. Return back quickly, slowly roll from the hip to knee, and you can bend the knee as you roll, or you can roll, hold the position, and then bend the knee. So the goal with this one is to mobilize this shin bone inward as this thigh bone is staying where it is. So I'm going to start on a high box or a bench or whatever you have access to. And again, here I want to keep my inner and outer heel on the ground and base of the big toe and the pinky toe on the box. I want to keep my heel heavy throughout, and I want to get this hip, knee, and foot in line. I don't want to be starting here. I want to get everything in line and move this leg slightly out of the way if needed. I'm going to grab my shin bone from the back with the same side hand here, and I'm going to take the other arm on top. And from here, I'm just going to push this knee forward as I'm going to rotate this shin bone inward while staying heavy on the heel and keeping this hip, knee, and foot in line. You might feel some of the same side glute engage, but what you want to do, you want to push the knee forward while staying heavy on the heel and rotate this shin bone in, return back, release the inward pressure, push forward as you rotate, inward as you push forward, relax on the way back. Staying heavy on the heel throughout, and make sure you're not going there. So now that we have the ability to internally rotate this shin bone, we're gonna go into this position, a fencer squat at the wall, or an early propulsion split squat like Bill Hartman calls it. I'm just gonna start in this position with my, again, capture the foot contacts. This foot is next to the wall and this knee is close to the wall as possible. I'm just gonna get in this position and I'm just slowly gonna lower down. The goal is to keep the knee close to the wall, the hip close to the wall, the inner heel down and base of the big toe down, and you're just gonna stay here for time. Breathe through your nose. When you do it right, you might feel some of the quad, inner quad engage here. You're in this wide stance. Don't go too low for now. For now, the goal is just to align this knee while keeping the heel heavy. If these help you, just understand that this is just a small piece of a full system. Imagine what happens when everything is structured, everything progresses, and everything builds on each phase. So if you have a knee pain and your knee hasn't improved yet, that doesn't mean you're broken. It's probably because you're training it like a hinge joint, or you haven't taken into consideration the fact that the body works as a unified system and your foot, knee, and hip work together in order to hold you upright, which is exactly what we work on in the program. If you like this conversation, and because we talked about the tightness at the bottom of the foot and stuff, you can watch my high arch video right here that dives deeper into the foot shapes that we need for that internal rotation to happen.